Hi, my name is Jessica Suba, and I'll be a junior this year at Riverside High School. This year I was in the Science Internship Program, and today I'll be presenting a 6-year retrospective review on the iatrogenic complication rate with total contact casting. Diabetes is a condition where insulin, a chemical secreted by the pancreas which allows glucose to enter the cells, is either not being produced, type 1, or is blocked by resistant cells, type 2. There are currently 25.8 million Americans with diabetes, and the number is continuing to increase. 15% of people with diabetes will experience a foot ulcer in their lifetime. 85% of all amputations are due to these foot ulcers, and one way to treat these foot ulcers is through total contact casting. Total contact casting is considered to be the gold standard technique for offloading pressures around these foot ulcers. A total contact cast contrasts to a standard plaster cast in that a total contact cast leaves no space or gaps, which reduces the chance of rubbing and/or any complication. Foam is used to cover the toes and any ulcer site. This reduces the pressure by 50%. Felt is used to cover all of the bony prominences to protect them from the plaster. Problems with the total contact cast include skill needed for application, time, expense, and materials. The availability of adequately trained and experienced cast technicians or physicians is lacking in many facilities. This is a major downfall to total contact casting, since improper casting can lead to skin irritation, ulcerations, and can lead to foot morbidity. The purpose of this study was to evaluate the iatrogenic complication rate and effectiveness of total contact casting in the past 6 years throughout the Cleveland Clinic facilities, and to assess whether there is a correlation between the derived variables and the complications that can present from total contact casts. For methodology, we obtained IRB approval and performed a retrospective chart review on patients with diabetes that were put in a total contact cast in order to reduce pressure. The variables included were age, gender, hospital location, cast technician, number of casts applied, location and duration of foot ulcer, if there was a complication, and what the outcome of that complication was. This study focused on the iatrogenic complication rate with total contact casting. 6.12% of all casts that were applied within the last 6 years resulted in a complication, while 93.98% were free from complication. Ms. Naubers-Franson did a study that included 88 patients that were followed until healed in a total contact cast. 9% of this complication had a complication in a total contact cast. The number of casts applied has risen each year. And as you can see, this is the number of complications from 2005 through 2011. Most of the total contact casts that the Cleveland Clinic applies are for foot ulcers. Out of the patients that were treated with a total contact cast, 175 of them were for ulcers, 78 were due to Charcot or fractures, and 15 were post-surgical. The most common complication, as shown by this graph, is the development of a new foot ulcer, the least common being the development of a callus or the existing wound enlarging. The chart shows the number of casts each Cleveland Clinic facility applied from 2005 to 2011 and the total percent of complication rate. The two facilities that applied the most casts are Lorain and Cleveland Clinic main campus. Lorain applied 652 casts with a 7% complication rate, and main campus applied 425 casts with a 2.4 complication rate. The most common location for a complication in a total contact cast was at the heel, 27.9%, and the calf, hallux, and dorsal were least common location, all at 2.9%. The percent of complications that healed was 79.1%. 17.9% of the complications are still active, and only 2.9% needed to be resolved by amputation. The complication rate increased the longer a patient remained in a single cast. To minimize the amount of adverse effects, we suggest a cast change be done weekly. Overall, the total contact cast is a viable option to the insensate patient with diabetes with low complications, as demonstrated in this analysis. We recommend adequate training of staff and the frequent use of this treatment modality to prevent these adverse effects. Further research should be done to look at and perfect the way a total contact cast is applied to minimize complications. I would like to thank Dr. Georgianne Botek, my mentor, and my co-mentor Tammy Owings, the whole ORI department, the Cleveland Clinic Office of Civic Education Initiatives, Ms. Rosalind Strickland, and Ms. Nedra Starling.